So all of that is unfolding and happening right now. And Dr. Group there, developing products for us, was able to talk to a lot of these senior people and medical doctors and others about what they're seeing and what's unfolding as Oklahoma City Hospital isolates a patient exhibiting possible Ebola symptoms, as Ebola pops up in Spain and other areas from them bringing in these Ebola patients, never before done. But former Border Patrol agent Zach Taylor has divulged that the CDC is working with Border Patrol authorities and the Department of Homeland Security to literally disappear potential Ebola victims attempting to cross the border in the United States. And there's no news coverage, no paperwork signed. They're put in vans and disappeared. Now we confirm that there's huge forces of vans and guys in literal spacesuits, like in Hollywood movies, grabbing people. And the Border Patrol goes, where are they going? Sign the form. And they go, slam the door. Group's going to tell you about this. So they brought up Taylor. He was saying his name. I went, wait, we know him. Went and checked. He confirmed this a month ago. But this is currently going on. So we need to get back with those sources where they suggest we go. McAllen, Brownsville, in Texas, or do we go to the Arizona border? Do we go to the California border? We need to show this because if they are doing their job, that's a good thing. But why would they be covering it up so there's not a panic? Undoubtedly, you got major African countries basically on the verge of collapse or collapsing. That's in the news, that term. African countries on the verge of collapse or are collapsing. You know, they're saying stay in your houses in Liberia, no public gatherings. I mean, this is crazy. UN models, 1.4 to 5 million to get it by December. I don't know if that's accurate. But Dr. Group joins us to talk about this. In the interview, the 27-year Border Patrol veteran, Taylor, was first contacted nearly 3 months ago in July, but InfoWars separately confirmed through other sources that the process was ongoing in the aftermath of America's first case of Ebola, which occurred in Dallas last week. They are literally grabbing people and disappearing them into vans. This is so big on so many fronts. Why would they be doing their job and doing this, keeping it quiet, Dr. Group? But then at the same time, and I want to hear it from your own words, debrief you here on air. We'll have you into the next hour. Why would they be doing that, A, but B, then leaving the planes open to fly folks in, and now they admit they're not doing even the heat screening. They're asking, do you feel okay? Well, someone fleeing Ebola or who has it, who wants treatment for them and their kids, they're not going to say, hey, I got Ebola, or hey, I think I got Ebola. They just want to live. I mean, all the other countries have sealed their borders. The other African countries have. So what do you think is going on here? Tell us what happened when you were in Vegas at this big trade show.
Well, there's a lot of stuff going on that I didn't really know about, and that's one of the reasons why that I went to Vegas, because the scientists that were coming together there were all focusing on what can we do about this Ebola situation. At least a lot of them were. And some of these guys I haven't met with for years and years and years, but it was more of like a meeting of the minds and coming together to see what's really going on. And I was pretty shocked. I have like 4 pages of notes that I wrote down because the stuff that I found out is not being talked about in mainstream media.
You have the floor. Go through what the Border Patrol told you first, what these senior agents told you, and then get into the whole list.
Well, I was shown a video of the guy that was talking about what's going on down at the border, and these guys know and have connections down there, and what they're saying is that people are that anybody with Ebola-like...
They were confirming, Taylor.
They were confirming that never before has the CDC and the National Institute of Health worked so closely with Border Patrol, and that they were down there grabbing individuals and putting them in vans and taking them to a quarantine location, and at that location, basically nobody knows where they were taking them to. Nobody knows what they're doing with them. I mean, are they trying experimental vaccines on them? Are they, taking their blood? Are they, who knows what's going on? I don't know if... My main focus is what we can do to educate the people about how to protect themselves, but at the same time, you have to get the information that's out there and then look at it and see if you can confirm everything. I just flew in last night and just this morning typed up all these notes so it would be fresh on your show today to share this information with all your listeners, because it's important to know what's going on so you can come to a conclusion on what you need to do and, what's really happening, because obviously when the mainstream media is out there saying one thing, it's something else that's going on at the same time. So other things on my list that I found was that the CDC was getting calls from doctors all across the nation I had talked to a guy that was, heading up some underground stuff for Ebola, and he said that doctors are seeing patients with Ebola-like symptoms and calling the CDC, and about half of those calls are going unanswered, or the CDC's not following up on those calls. Different changes that are happening with the CDC and the WHO changing up their website, basically saying that now, it possibly could be airborne, which we talked about before. But just think about it. I mean, if you cough, if you sneeze, those are droplets of bodily fluids. I talked to one guy that was telling me that the CDC is now warning airline crews to start using masks. Why would they be warning people to use masks if it's not airborne? Another thing that's happening is the government is cracking down on natural health care companies right now, too. I mean, there's a big attack on anybody advertising anything about Ebola. There's an attack on colloidal silver. Anything, they're scouring the websites out there to see who's advertising anything natural against Ebola. But the thing is, I mean, the easy solution is just keep your immune system strong, and you should be able to fight it off. Usually with Ebola in the past, this was another guy that was talking about how the transmission, the indigenous tribes that are in the jungle usually get Ebola from eating monkey meat or something like that, and then they pass it to the city. But the strange thing about this is 3 cities at about the same time, the Ebola was released in the city. So it's actually the mechanism of action of spread has been reversed. Instead of jungle to city, it's now city to city to city. So that was an interesting point, because that would make you want to look at how all of a sudden did Ebola get released inside 3 cities at the same time. So that was interesting. Another thing that they were talking about, somebody had some friends at Emory University, and they said that it took 40 bags of medical waste a day from the 3 infected Ebola patients that were at Emory University. So you can imagine if 3 patients create 40 bags of medical waste a day, what would happen with 1,000 patients, or what would happen with 5,000 patients. I mean, there's no possible way to control that much waste. And the fact that there are only 4 hospitals in the U.S. that are technically qualified to handle pandemic outbreaks.
And let's just go back. It used to incubate over 3 days. Now it's 21. The virus has just mutated off the chart. This is very suspicious.
Yes, the Ebola virus is kind of like the influenza virus because it will mutate. And that's a reason why, I don't know how you're going to possibly come up with a vaccine with a virus that mutates like the influenza. But, what's happening also is that if you look at what's happening the whole quarantine thing has just been completely taken out of control. We should have shut our borders to any type of flights. But another topic that we talked about was the fact what's going on with the military over there. Why are we sending military when we should be sending doctors? It's a pandemic. Well, they need doctors, not military. So what was reported back to me was it was kind of a drill to see how to quarantine for medical martial law in the United States. They're literally going door to door, the military, pulling people out that have Ebola-like symptoms.
And our military's definitely going to get it. And then that'll be covered up. They'll use them for guinea pigs as well.
And they're taking them to quarantine areas. And now the families know this, too, so they're trying to hide people. So what this is a plan to see how they're going to react into the United States.
It's to create a cadre brigade. That's why it's 5,000, to come back and train the rest of the brigades.
Yes. And now what happens when you take everybody and put them in quarantine? Well, this is how the economy collapses real fast, because how does the food get from the farm? Nobody wants to go to work if there's a quarantine and they can't leave their own homes. So you have distribution that completely comes to a halt. You have food production that comes to a halt. The food can't get to the grocery stores. Every single worker, all the waste workers, the government workers don't go to work. And when you take everybody away from going to work,
we're going to break.
The economy starts to crash.
It means societal collapse level event. Dr. Edward Groups, our guest, Infowars.com, has the breaking news, and the article is being expanded as we speak. Former Border Patrol agent, senior agent, CDC disappearing potential Ebola victims. It's currently going on.
Silver has always been nature's very own antibiotic, and only one system allows you to generate an endless supply of natural silver solutions. SilverLungs.com. You'll find no wild claims or pseudoscience, just a lifetime of nano-sized pure silver solutions. The Silver Lungs generator allows you to make your own, so stop paying for silver solutions. The unique lung delivery system targets respiratory infections where other silver solutions simply cannot reach. See the Silver Lungs generator and lung delivery system at SilverLungs.com. That's SilverLungs.com.
Hi, this is Ted Anderson. Have you ever wondered why banks, stockbrokers, investment advisors won't talk about gold IRAs? They've been available since 1986, yet the financial industry won't recognize the value of gold for your retirement. Gold has outperformed paper investments, yet no word about IRAs. If you would like to have gold for your retirement, call 800-686-2237. Don't get left behind by rising inflation and low returns. Call 800-686-2237. Secure your future and call 1-800-686-2237.
What good is a Big Berkey water filter?
We get that question a lot here at BigBerkeyWaterFilters.com. And in a word, the answer is protection. Protection from water main breaks, E. coli contamination, environmental chemical spills, pesticide runoff, chlorine taste and smell, and all forms of fluoride. Plus, Big Berkey water filters are the original gravity water filter system and most trusted on the market for a reason. Tested by multiple independent NSF EPA certified labs, they are the gold standard in water purification. At only 1.7 cents a gallon, a single set of filters can last for 5 to 10 years. That means big savings. Big Berkey, the one that's powerful enough to purify stagnant pond water. Get a Big Berkey today at BigBerkeyWaterFilters.com. GCN listeners receive 5% off all ceramic filter systems. Visit our website or call 1-877-99-BERKEY. That's 877-99-BERKEY. Big Berkey Water Filters, for the love of clean water.
Hi folks, Alex Jones here with some important information. I want to tell you about Matt Redhawk and his team of patriots over at My Patriot Supply. Several years ago, Matt was sitting in his 2-bedroom apartment, frustrated with the direction this country was headed, and the charlatans willing to sell us out for a quick buck. Deciding to take action, a company run by patriots for patriots was born. My Patriot Supply has never taken a loan or accepted outside funding. They now operate 2 distribution facilities and employ over 50 hardworking American men and women. It is rare to find companies who practice what they preach. And that's why I stock my pantry with high-quality storable foods from My Patriot Supply. Go to mypatriotsupply.com/Alex today for special offers on emergency food storage, or call their preparedness specialist at 866-229-0927. That's 866-229-0927. Do business with someone who shares your values. mypatriotsupply.com/Alex.
On September 30th, 2014, the first confirmed case of Ebola appeared in the U.S. This, combined with several other unidentified viruses, have some of our customers at 30dayfoodsupply.com concerned about the safety of our domestic food supply, resulting in a surge of our $99 90-serving kits. While we at 30dayfoodsupply.com have no expertise in epidemiology, we are aggressively purchasing raw materials that are currently in stock, and we intend to continue to sell our 30-day non-GMO emergency food supply for only $99 as long as we can. Oregon Trail Foods and 30dayfoodsupply.com keep prices low by buying directly from the producers in Oregon and then pass the savings on to you. Call 541-229-0010 and purchase our 30-day, 90-day serving emergency food supplies for only $99, and $10 ships your entire order to the lower 48. Visit our website at 30dayfoodsupply.com or call 541-229-0010. 541-229-0010.
He's the T-Rex of political talk. Alex Jones on the GCN Radio Network.
We have breaking news in the next hour. Turns out those FEMA coffins, CDC does want them. Put as many as 4 dead people apiece into them. That article's breaking at Infowars.com the next hour. Dr. Ed Group is our guest. We'll open the phones up in the next hour with Dr. Group. I'll just keep you the whole 2 hours that we've got left, or an hour and 30 minutes, 35 minutes now, if you can do it. Doc, continue getting into, you're at this big medical conference, doctors, scientists, epidemiologists, virologists, border patrol, pharmacists, developers, chemists. You're there talking to them, and everything you're saying has already been separately confirmed. You were talking about how in Africa, they call them these community care centers, But really, they're just death camps. Well, that's even been in the back of the news.